Carla Boisvert had just begun to grieve her mother's death when she saw it added to the province's death toll.
That's really what hit me when I read that a person in their 60s died in the Saskatoon zone. And I was like, that's my mom. And she had no name. She was just a number.
Her name was Patricia Lingle. Her death, says Boisvert, an indicator of strain on the healthcare system. Lingle was dying of cancer, but still able to stay in her own home with nursing support until staffing shortages interrupted her care.
If a nurse gets exposed, then they have to be on the 2-week quarantine. So there was some days where no one could come. And that, in my mom's case, literally meant she was sitting in her own filth.
So Lingle had to go to a Saskatoon hospital, and that's where she was exposed to the virus.
My mom should have been able to go to the hospital and get the care she needed without getting more sick.
The grandmother died from COVID-19 within days.
This is the ripple effect. A strained system, understaffing, overworked, exhausted workers. They're getting sick and they're doing their very best, but my mom wouldn't have gotten COVID in the hospital if the hospital wasn't maxed out.
Carla Boisvert wants to honor her mother, a retired nurse.
She was always someone who wanted to help other people. So I'm hoping to find some purpose, or at least to help me process the grief, because it's immense. I look pretty functional today, but there's days where I'm not, and I have not known a loss like this.
And so Boisvert is reminding people that we are all part of the system and can all do our own part to relieve pressure on it. Bonnie Allen, CBC News, Regina.